He is a case of complex recurrent horseshoe fistula with bilateral supralevator abscess with transpintric branches on the right as well as on the left. Internal opening is at 6 o'clock. I'm doing gentle PR. I can feel the internal opening here. Supralevator abscess can be felt at the tip of the finger. Then there's an intersphincteric abscess, which is kind of intersphincteric hypergranulation, which is extending from 3 o'clock to 9 o'clock. There's history of multiple surgeries in past. One can see the scar of previous surgery. So he has undergone 4-5 surgeries. I'm trying to put the probe inside the external opening here, and the probe is easily going inside the supralevator space. Now I'm directing the probe towards 6 o'clock position, and the probe is coming towards 6 o'clock. The plan here is to perform DLPL, that is distal laser and proximal laser. Step 1, I have identified the internal opening here. I am putting my laser fiber inside the opening. The idea is to preserve the intersphincter and the mucosa. So I am guiding the fiber inside, and I'm hitting the internal sphincter here. Now I'll extend this towards 6 o'clock. I can easily introduce my fiber towards the right side of the patient. I'll just widen the neck for the drainage of the intersphincteric abscess on the right as well as on the left side. This is the most important step, called as exploration of the internal opening and widening of the intersphincteric space for drainage of the intersphincteric abscess. I will be extending this incision towards the anal area for drainage, which is extremely important in first 3 weeks. Now I am trying to introduce hydrogen peroxide through the external opening, and one can see the hydrogen peroxide coming out to the internal opening. Hydrogen peroxide, but one can see the hypergranulation, the infected unhealthy tissue popping out. That means we have done effective widening of the intersphincteric space, because hydrogen peroxide could come out easily and the space is nicely opened up. This tissue will also go for histopathology. So next step is laser debridement of the fistulous tract and the supralevator abscess. So I'm introducing my radial fiber inside. I'm 1 centimeter deep. Now I'm 2 centimeter inside, 3 centimeter, 4 centimeter, 5 centimeter and 6 centimeter. That is the supralevator abscess. So I'll be delivering around 100 joules of energy per centimeter. You can see the bubbles coming to the internal opening now. So by now I have delivered around 700 joules of energy. Now because there is no external opening to his right side, I'll be debriding the intersphincteric space and the supralevator abscess on the right side through the internal opening. So I'm introducing my laser fiber through the internal opening here, and one can see my fiber going towards the right side now. I'm already there at the level of supralevator abscess, and I just move the scope towards the right side. One can see this laser beam on the right side at 9 o'clock. So I'm delivering around 100 joules of energy, and I'm gradually withdrawing the laser fiber. So that was laser debridement of the intersphincteric space on right side along the supralevator abscess. Step is to debride the intersphincteric space through the internal opening. So I'm introducing the scoop inside, and I'm directing my scoop towards 9 o'clock position, and I'm taking the muck out. One can see the muck coming out. This will also go for histopathology. So I'm scooping it. Good scooping of the intersphincteric space is the key to success. Similarly, I'll scoop through the external opening on his left side. I'm scooping the supralevator abscess now, taking all the muck out, and can go beyond to 9 o'clock position taking all the muck out. Next step is widen the external opening. So I'm widening the external opening in the direction of the internal opening, and I'll just make an incision. This widening is the key because it will allow drainage of the abscess cavity, which is here. One can see this. The cavity can efficiently drain in first 3 weeks. Thus it prevents collection. And I'm introducing the tip and through the intersphincteric space. Now I will try to take it out in the deep anal space. One can see the tip of the balloon going higher up underneath the mucosa in the intersphincteric space from 6 o'clock to 9 o'clock. And I'm holding the balloon now. This is the one which will be inflated. So I'm inflating the catheter with normal saline. I'm now inflating the balloon. I'll inflate the balloon by around 2 ml. And one can see the balloon getting inflated in the intersphincteric space here. This is the space. So we'll inflate the balloon by around 3 cc and stop. We'll take a knot, tighten the knot, and then cut the length in such a way that it remains buried inside. So I'm going to cut it 1 centimeter inside the wound. You can see the bulb is still inflated inside. It remains inside in inflated state. So the bulb is there inside in the inflated state. So that was DLPL, that is distal laser, proximal laser, in the case of complex horseshoe fistula with bilateral supralevator abscess. For faster healing and efficient debridement, we have used best technique in this when we have used the tube drain for drainage of the intersphincteric space. This is Dr. Ashwin Porwal from Healing Hands Clinic.